Welcome to 50 Plus in Montgomery County, a monthly program that is produced by the Commission on Aging, of which I am a community member. The show is insightful for people of all ages, and each episode takes a fresh look at important issues by spotlighting older adults in the community, representatives of services and programs, and activities of interest to older adults. My name is Katie Smith. On this month's show, we'll talk about medication management. Joining me is Dr. Tricia Cash. Dr. Cash received a Bachelor of Science and Doctor of Pharmacy from Purdue University. She's currently employed by the Frederick Regional Health Systems, working with primary care physicians through the Frederick Integrated Health Network. Dr. Cash is passionate about working directly with older adults to improve their medication regimens, safety, and systems in various settings, including long term care, environments, hospitals, and patient homes. Welcome, Dr. Cash.
Thank you.
Dr. Cash, let's just go ahead and set a foundation. Can you tell us what is medication management?
So medication management is basically a strategy to create with patients to help them identify what medications they're on, to help them develop a list to provide to their doctors, pharmacists, anybody that's in their healthcare realm.
Hmm. And why is it important to have an accurate medication list as you're managing your medication?
So especially as we get older, we tend to have multiple doctors, providers, people that are helping us with our care, and people that are prescribing medications to us. And as that happens, sometimes the medication list can have duplicates. There can be side effects that are possible. Um, uh, Duplicate medications as well as adverse drug effects can occur with medications being prescribed with similar side effects. There can be drug interactions that can be a problem, as well as someone can maybe possibly be given a medication that they may be allergic to. So having a complete list of not just prescription medicines, but also over-the-counter medications, supplements, etc., can be really helpful in looking at the big picture of the medications that people are taking.
All right, so as we look at the big picture, can you identify any key elements of medication management? And are there any particular methods that people should use when they're keeping a list?
Yes, I think a list is really important, again, to look at all medications. I do a lot of home visits. I'm fortunate to do that. And I often see people, oh, I have that at my bedside. I have this in the kitchen. I have this there. And having a complete list can be really important. And sometimes people forget those medications that they use only on an as needed basis,
Mm.
or maybe their thyroid medication that they take first thing in the morning and they don't think about putting that on their list. And it's important to have all the medications listed.
Mm. Are pill organizers helpful or some sort of schedule?
Yeah, so one of the things that I'm fortunate to help people do is to set up a system to help them figure out when to take a medication. To use pill boxes is what we use, I would say, most of the time. But sometimes people don't want to do that, so they'll come up with a different system. But whatever works for them. Here in Frederick County, we're really fortunate in that we have a group of nurses through our hospital system that actually come in and help patients with pillbox fills, helps them with refills and things like that. So there may be systems or people available throughout the community that might be able to even help with organizing their medications.
All right. Now that we know what medication management is and why it's important to keep a list, how can we make sure that all of our clinicians know what medications we are taking?
Ideally, I like people to bring actually their bottles with them. I sometimes get a little pullback on that. So if that doesn't work, a medication list, but making sure it is accurate can be really helpful. And
Mhm.
taking it to every provider's visit is really important. And it should be part of the beginning of the process of seeing a provider is that somebody looks over the list to make sure if medicines have been added since the last visit that that's identified. It's also important that sometimes in my practices, since I work with primary care practices, there's a doctor will see a patient and realize that I really don't have a good picture of what's going on with their medications. And I'll do a home visit. So that's when home visits can be very helpful. And home healthcare nurses, if they're involved, or other nursings or other practitioners that are in the home can help identify that and see medicines in the home. So sometimes it needs to be done in that way, but oftentimes taking that list or that medications to your provider can be the first step.
Now, Dr. Cash, you mentioned, taking your medications to all providers. We know that pharmacists like you, doctors of pharmacy, they're also included in that provider, list. How do like having those medication lists, how is it helpful for your pharmacist and or your pharmacy?
It can be really helpful in identifying, especially drug interactions. I saw someone this morning, and she was giving a medication for sleep yesterday by her primary care doctor. And the pharmacist caught that there was an interaction with one of her cardiac medications and probably wasn't the best choice, and asked her to reconsider that and go back to the provider and discuss alternatives or different ways of treating her sleep disorder because it was interacting potentially with her cardiac medicine. So using the same pharmacy can help pick up on that, whereas it may not be picked up if you're going to multiple pharmacies. So I know sometimes with cost, sometimes people aren't using their insurance, and so it's not captured from the insurance standpoint. And insurance companies can identify drug interactions when they're processing their claims, but since some medications aren't processed through the insurance company, having the pharmacist have a check system in place as well can be very important.
Well, Dr. Cash, why is it critical then to tell, your providers, and again, that could be a physician, a clinician, or a pharmacist, maybe about any allergies that you have when you are taking medications?
Sometimes we think that allergies are just, well, that one drug, but sometimes allergies are throughout a spectrum or a family of medications. So if you had a interaction with one drug and then a doctor prescribed another drug in the same family, then it can be identified, and making sure that the doctors and the pharmacists know of those allergies is really important. I know since I work for a hospital system, but I work in a primary care practice that is not owned by the hospital, oftentimes the allergies in one of the electronic medical records is totally different than what is in the hospital, or vice versa. The primary care has a different list of allergies compared to the hospital. And having that consistency and making sure that that's clarified is really important, obviously, when you go to prescribe medications.
All right, Dr. Cash, let's review again. Again, we know what medication management is. We know that it's important to have a list. We know the key elements of medication management, and that could be a pill organizer, it could be keeping a schedule, and as you stated, whatever works well for the patient, but obviously keeping it in a place where we can remember. We know, as you stated, to bring our medications to our doctor's visits because that will help them just to kind of know what we're taking and to keep the same pharmacy. Your pharmacist, you interact with them more often than you probably do your regular doctor, so they can talk about any interactions with your drugs. But we have all that. How often should we be reviewing our medication lists?
So there is, before we go on, I do want to mention also over the counters and supplements and medical
Mhm.
marijuana or other types of products that might be being used. Having that complete list is also really important because there could be interactions there. And I failed to mention that earlier, so I want to mention that. I would think yearly at least is important to review your medications. And Medicare does have a comprehensive medication review uh, opportunity for going over with your provider or with others to make sure that you are looking at those medications at least yearly. And anytime there's major changes in your medications, when people move from, let's say, a short-term rehab facility back to home, a lot of times there's many changes. So having a good review of your medications at that point is often very beneficial as well.
Wow, thank you for that. So we review it annually. And how can we manage our medication safely?
So I think the big thing is feeling comfortable with what your medications are for. I have at the bottom of the screen an information that kind of questions to ask your doctor, knowing why you're taking medications, the best time of day, knowing the most common side effects. So if you do have a problem, you can go to your physician and discuss what alternatives you have as far as that therapy is concerned. And just being aware and having that open communication with all your providers, including your pharmacist, is really important.
Mhm. Now, it's my understanding, Dr. Cash, that on October the 28th, it's National Prescription Drug Take Back Day. And I know that you probably can, dispose of your medications, not only that day, but even, throughout the month of November. But what should we be doing to manage? What should we be doing to manage expired and or discontinued medications?
Just like you look at your medications on a yearly basis, at least annually going through your medications and making sure that if you have expired products, medications you're no longer using, that you do pull those out. Oftentimes people will take medications inadvertently thinking they're still on it when they may not be no longer using it. So updating that, keeping your medication medications up to date and not having expired agents around the home is really important. As you mentioned, there's a drug take back day, October 28th, and I think there's usually one in April as well. And there are drug take back boxes within Montgomery County, I think 6 at the police departments, that at 6 different police departments to help you dispose of your medications. So disposing of them properly is also very important.
Dr. Cash, I know that I've certainly learned a lot today. Thank you for coming to talk to us about medication management and just really educating us on how we should engage with our providers. That includes our pharmacists and our pharmacies. Is there anything else that you would like to share?
No, I just think that using your pharmacist as a resource is very valuable and oftentimes overlooked. And keep in mind that your pharmacist is a big part of your healthcare team and to use them when necessary.
Well, thank you so much. And how can we stay in contact with you? Do you have an email address, a phone number that you would like to share?
You're more than welcome to contact me at P as in Patricia, Cash, C-A-S-H, at frederick.health, or you can call me on my work number, which is 240-457-2798. I look forward to your call or your email.
Thanks so much, Dr. Cash.
Thank you.
Up next, we'll talk with Dr. Jean Dinwiddie. Dr. Dinwiddie serves as a commissioner on the Montgomery County Commission on Aging. Welcome back to 50 Plus in Montgomery County. Joining me is Dr. Jean Dinwiddie. Dr. Dinwiddie received her Doctor of Pharmacy from the University of Maryland Pharmacy School. She's also worked as a consultant with pharmacists in long-term care, as a clinical coordinator at the George Washington University Physicians Group, and as a director of client services at PharmaCare. Dr. Dinwiddie is a commissioner on the Montgomery County Commission on Aging, as well as she's the producer of this show, 50 Plus in Montgomery County. She also serves as a co-leader of the communications work group of the Montgomery County Age Friendly Initiative, and as the chair of the Gaithersburg Senior Advisory Committee.
Oh.
Welcome, Dr. Dinwiddie.
Oh, thank you, Katie. I'm as red now as the background. Thank you for that. Thank you for that beautiful introduction.
Absolutely. You are certainly very accomplished, and this show wouldn't exist without your input and direction. So thank you so much. Let's just go ahead and jump right in. Tell us the main difference between over-the-counter drugs and dietary supplements.
Well, both of those you buy without a prescription. So people often lump them both together, but it's important to know the difference between an over-the-counter drug and an over-the-counter supplement. And you can tell that by just when you pick up the bottle, turn it around. And if it's a drug, it says drug facts. And if it's a supplement, it says supplement facts. And why that's important is because they're regulated differently. The FDA regulates both, but the drug facts, manufacturers do those based on a monograph, a kind of a recipe. And so it's approved beforehand, and then manufacturers follow this recipe of here's what's in this. For supplements, they're not regulated that way at all. So before they're the FDA doesn't review them before they get on the market. The FDA only really becomes involved once the supplement is on the market if there's a problem. You'll notice that every supplement will have the words not intended to be used to treat, diagnose. I mean, they have a lot of warnings there because supplements, and it will always say these statements have not been evaluated by the FDA. So there are some sort of natural supplements, and people tend to think that natural means safe, and natural doesn't mean safe. I would remind you that poison ivy is natural, and yet none of us are going to go out and, roll around in poison ivy. And one of the main, we see a lot of, every commercial on TV is drug, car, drug. Well, you'll notice for the drugs, the prescription drugs, they have to give you the side effects and the warnings. And sometimes those can be very scary. But for the supplements, like there's one well-known one for brain health, it doesn't list any side effects. And it's not because there aren't any side effects. It's because of the way they're regulated. So the supplements can make claims. So, and it's important to know some supplements, absolutely, there's good data behind, they work for people. I want to get into a few of the problems, and I'm sorry, Katie, I'm just talking and not even letting a few of the problems with supplements. So like Yohimbe is used to treat erectile dysfunction, but it can cause heart arrhythmias. Ginseng, which is in tea and other things, can interfere with a whole lot of drugs. It can decrease the effectiveness of warfarin. It can decrease the effectiveness of antipsychotics. I had a friend who was very well controlled who wound up hospitalized because he fell in love with ginseng tea. Another one that many older women in particular use for hair and nail health, that contains biotin. And biotin interferes with one of the lab tests that they use to see that you're having a heart attack. It can cause a false low. And sadly, biotin only works if you have a biotin deficiency. if you don't have that deficiency, it's not going to make your hair all lush. But if you want to take it, if you want to take supplements, then I recommend that what you use, look for the USP symbol on that supplement. USP, and I'm sure we'll show a picture of it. USP stands for the United States Pharmacopoeia. And when you see that symbol, you know what's in that bottle is what's on the label, and that's all that's in the bottle. They have found, they did a study in the Journal of American Medical Association not terribly long ago, where so many supplements are adulterated. They have ingredients in them that aren't at all on the label, and some of them were prescription ingredients. So I think I probably run through everything, Katie. Let me pause and allow you to ask a question. Sorry.
No, Dr. Dinwiddie, that was fantastic. I mean, we know the difference now between OTC or over-the-counter drugs and dietary supplements. You've told us about the various types of supplements they are, and that many of us have either used before or currently use now. You talked a little bit about the approval process and why it's important for us to make note of that. But let's go further into the safety part. You mentioned the USP, and we should make sure we look for that on that label on the bottle. So, like, what are the best practices to adhere to when we're taking supplements? And you mentioned also a little bit of the risk and precautions, but could you go a little bit further into that? So many women take biotin to make their hair more lush, to grow thicker, stronger. But what are some of the other risk and precautions of taking supplements?
Well, I know your previous guest, Dr. Cash, mentioned the list, and it is so important that you include all of and I know Dr. Cash mentioned this as well. I will just reiterate, make sure those all of the supplements, all of the over-the-counters that you use, including some you only use sometimes, are on that list, and keep an accurate list. Because if you're on biotin and God forbid you have a heart attack, if the doctor in the emergency room is aware, they will use different methods to determine, your health state. So it's that keeping a list. Also, I'm a big proponent of pharmacists. So check, not every supplement has great data behind it. Some supplements do, some don't. There's one now that many people know as we get older, we all want to preserve our brain function. There's a commercial that we all have seen about a product this is going to make you sharper, keep you smarter, longer, all of that stuff, and clinically tested. Well, this particular product was tested by people who work at the company who produce it. Now, that's not, they had a certain interest in making sure that the trial turned out a certain way. Now, and the one I'm thinking of isn't particularly unsafe. Its toxicity is mainly to the wallet. So before you spend a lot of money on supplements, because some can be quite costly, I would say talk to a pharmacist or your physician, but the pharmacist is the drug expert. So talk to your pharmacist about, what supplements have good data behind them and what don't. Because it's going to be very individually dependent, that particular patient.
Dr. Dinwiddie, you mentioned that you're a big proponent of pharmacists. I want to say that I too am a big proponent of pharmacists like you, as well as Dr. Cash and others. Now, when we think about supplements, there are some benefits. Can you talk about any of the benefits of taking supplements and what they're commonly used for when they are helpful?
Sure. A multivitamin is considered a supplement. And multivitamins can be useful. There's a lot of debate about how, what's better, a diet or a multivitamin, but certainly taking a multivitamin can be a good practice. Turmeric is used for arthritis and inflammation, and that has good data behind it. So there are supplements that we use, calcium. Many women are told to take calcium for their bones or vitamin D, and those are all supplements. So those are good uses of supplements. But there are some that are just, look for the USP, so you know that what it says is in the bottle is actually in the bottle, and that's all that's in the bottle. And ask your pharmacist is this one worthwhile? Does this one have good data?
Now, Jean, Dr.
Dinwiddie.
Dinwiddie.
We've worked together so long. I'm Jean.
How important is consultation with a healthcare professional before starting supplements? I mean, you mentioned that there are some that are actually helpful to us, like our vitamins, like turmeric, like calcium. But even before I or someone else decides to, take a turmeric supplement, when should we be talking to our physician or our clinician about that?
You should talk to them about the drug interactions. And Dr. Cash mentioned medical marijuana. That's another one. And the medical marijuana, it has some uses, also has a lot of drug interactions. Mm-hmm. So that's pretty much your concern for medical marijuana or starting a supplement, as long as you know the supplement has good data and it's going to work. Otherwise, why bother?
Dr. Dinwiddie, you alluded to this, but when should we choose supplements over medications and over-the-counter drugs? I'll just go ahead and say, I know some people in their household, home remedies are a thing, right. And they may use a home remedy as a supplement or some other vitamin, but when should we take one or the other or together?
I don't want to discount home remedies because sometimes they work. And sometimes the older medicine. I am a traditionalist and educated with Western medicine, so I tend to prescription, my preference is the prescription medicines and the over-the-counter drugs. And if you looked in my medicine cabinet, you'd see, of course, all generics, and any supplement has a USP label on it. I take vitamins, I take calcium. So some things that you need, you can't get. You can only get as a supplement. The calcium and vitamin D, for instance. I don't want to discount home remedies, and I'll just say I lean towards the more traditional Western thing. But there are people using these home remedies that work for thousands of years. That's as I can comment.
Well, Dr. Dinwiddie, we've covered a lot of ground here, but is there anything else that you would like to share with us that perhaps I didn't ask you through one of the questions? I mean, you're talking about supplement, safety, and medication management, but is there, anything else that you would want to make sure that we know about?
I think we've covered it. Keep a list. Put every single thing you've ever put in your mouth that could be considered medicine. Put it on the list, show it to every doctor every time. My experience getting older is you just collect doctors. So show every doctor every time and your pharmacist.
Well, thank you so much, Dr. Dinwiddie, for coming on and speaking with us today. Thank you for also being one of the great producers of this show. It happens because of getting your input and direction, but I'm just really happy to be able to speak with you today.
Oh, Katie, you are wonderful. Thank you.
Until next time. Well, that concludes our program for today. As you can see, the voices of those 50 plus matter every day and in every way. To learn more about services for older adults in Montgomery County, please visit the Montgomery County Seniors website by visiting montgomerycountymd.gov/senior or call the Senior Resource Line at 240-777-3000. And as always, thank you for watching 50 Plus in Montgomery County.